Although you may not think of biomedical engineering when you hear HIV or HIV prevention, there are actually many tools that we use to understand what are the factors that predispose someone to increased risk. HIV stands for the human immunodeficiency virus, and it affects populations of people differently and varies based on global region and location. Because we look at HIV prevention from a global perspective, we are specifically interested in the vaginal microbiome and how HIV disproportionately affects women of color.
During the acute stage, it's very hard to detect the HIV virus, at least symptomatically. And so that's why it's important to occasionally get tested for HIV before it develops into AIDS.
Because of the discrepancies and the lack of information in data sets that already exist, we're trying to create and generate our own data sets. Machine learning, while it's incredible, it doesn't work well if your data collection processes are not performed well. So we're trying to collect as much data as we can from as much women as we can, and we're trying to make sure we include all of the metadata that we're allowed to on their backgrounds, their ethnic groups.
One of the reasons I really care about this work is based on the time that I spent as a Fulbright scholar in South Africa. There, my project worked to interrogate mechanisms of trained immunity, which is really important to understand in trying to alleviate mother-to-child transmission of HIV.
We're finding that there's an increased risk of a mother with HIV, even if she's receiving antiviral treatment, she has an increased risk of passing that down to her child.
So the overall goal of this lab and this work is really to improve HIV prevention strategies that are affordable and that make sense for each person's global context.
My goal for the research is to extend the quality of life of people and individuals who live with HIV and women with BV in order to design new treatment options and prevent new infections.
I really just want to make a difference in one person's life. I know we often talk about big concepts like improving health outcomes for all patients worldwide, and that would be great. But if I can even help one person maybe respond better to a vaccine or somehow improve their treatment, I'd be very happy.